Dr. Brennan here, and in today's post, we're going to talk about 5 back pain myths that even your doctor might believe. So these days, it can be really hard to know what to believe when it comes to back pain. Is it my age? Is something out of place? Do I need an MRI? Should I stretch it? Should I strengthen it? Is it my core? Sad truth is that many of the things that we once thought about back pain and sciatica have gone the way of the Bigfoot. Myths that are hard to shake. Heck, even AI will tell you to stretch your hamstrings and strengthen your core to get rid of back pain. But in today's post, we'll cover what the science says about these myths and, more importantly, what they mean to you and what you can do about them instead. First myth is that you need an X-ray or an MRI to see what's going on. So have you been told that you have changes on your X-ray MRI? These usually go by the names of degenerative disc disease, lumbar stenosis, bulging discs, herniated discs, loss of lordosis, or too much curve in your spine. Often these words are tossed around pretty casually and usually not explained in any great detail, which then leads us to ask Professor Google what these words means. And guess what's at the top of the rankings? Usually the worst things you can possibly think of. So let's break down some of the real meanings of these terms and what they tell us about our backs. Degenerative disc disease, right? Sounds bad, makes you think that it's only going to get worse. And that if it's a disease that's in my back, maybe it's the cause of the back pain. Well, what if I told you that it is neither degenerative nor a disease? When we first started using MRIs, doctors coined this phrase to talk about changes they saw in the spine, and especially as somebody got older. What they didn't know at the time was that those changes are also in people without any back pain at all. So when we first started using these MRIs, doctors coined this phrase to talk about the changes that they saw in the spine, especially as somebody got older. What they didn't know at the time was that these changes are often found in people in their 20s, 30s, and 40s. What's more is when we target the areas that they find on the MRI with medical treatments, they often have little to no effect. I've even heard of doctors telling their patients that because of what they saw on an MRI, that they have the spine of an 80-year-old, and this often stops that person in their tracks because if it's degenerative and their spine is already that of an 80-year-old, they better play it safe and make sure they rest as much as possible and only do safe things because if they wanted when they lift or run or their back would hurt. So when they did this, they really created a self-fulfilling prophecy because now their support system for their spine got weaker and weaker until doing basic things would set off their back pain. Unfortunately, this group is usually often shunted off to pain management and a lifetime of shots and dependency on medications and ultimately surgeries, some of which even the surgeons wouldn't have themselves. So now, what about stenosis? This one comes along with degenerative disc disease. Do you know that the spine has a lot of space? And if the doctor sees some narrowing, it's often more than not, you still have enough free space in your spine to do just about anything, even if you feel a little bit stiff when you start moving. In fact, your nerves move, in order for your nerves to move freely, you only need about 1/3 of the space available. What's more is the older you are, the more likely you are to have this happening and not know it because you didn't have any pain. All right, so this next myth is pretty common, and it's the myth that you hurt because something's out of place. Did you know that it takes over 2,000 pounds of force to stretch your fascia or the glue that holds us together by just 1%? And that it takes over an hour, sorry, with a hammer and chisel to separate your SI joint with two people on a cadaver that's not fighting back. Yet when we're dealing with back pain and sciatica, it can feel like something is out of place, like one hip is higher, or if we could just pop it, things would get better. But what we've understood for probably about the last 20 years about pain is that it has very little to do with the positioning of the joints. So what's really happening when you hear all those pain relieving pops when you get an adjustment? Or how about when those knots disappear after a massage? Or how you know you've been shown an x-ray with the answers as to why you hurt? Maybe you lost the curve in your neck or your back. The simple truth is that when we get an adjustment or a massage, we give our joints and muscles, and especially the nerves, three things that they need to thrive. We give them movement, blood, and space. I don't mean that the adjustment somehow opened up anything or that now they've made your muscles longer, or even broken up scar tissue, unless you're a massage therapist or chiropractor is superhuman and can move a ton with their bare hands. What they've really done is move your joints, muscles, and nerves in a certain way that resets your body's living alarm system, i.e., your nerves. And unfortunately, without doing the right kind of movement to reinforce this, your alarm system will then trip, requiring another trip to the massage therapist or chiropractor, and the massage begins again. This reset to your alarm system is why you feel more aligned with better posture. You feel looser with less pain after an adjustment or massage. But this is a good thing. It means that you're a rapid responder to the right kind of movement and that you have the ability to heal yourself and get back to running, lifting, and enjoying life. You just have to figure out what the right movement is specifically for you so that you can start to feel better and start to heal yourself. All right, so this next one, it kind of makes sense, when we're hurting, we don't want to be active, we don't want to do stuff, and so more often than not, we think that rest is best when it comes to pain. which is true for maybe like the first 48 hours after maybe picking up an injury. But after that, generally, the more we rest, the stiffer our joints get. Actually, the more our alarm system will start to go off when we start moving again. And so, when it comes to specifically back pain, what we used to think of, oh, well, we need to rest for 6 weeks and then, and then get back to life as normal. What really happens during that time is that we actually start to get weaker. Our alarm system becomes easier to trip, it becomes easier to hurt, and more often than not, we find ourselves stiffer and in more pain than when we started. And what's more, when we've rested for, whether that's 2 days, 2 weeks, more often than not, our alarm system, our nervous system creates this protective buffer around a movement. And so maybe it was bending forward, maybe it's reaching for something, maybe it's turning, to look over your shoulder in the car, or maybe it's just sitting for too long. And so more often than not, if we don't start doing some gentle stretches, some gentle motion, our alarm system will become easier and easier to trip, which then kind of leads us down that path to maybe getting injections, having to be on certain dangerous painkillers, or even having to go get a surgery for something that we could have dealt with naturally with movement. Myth is probably the one that irritates me the most, and it's really the thing that holds a lot of people back because they're told that their back pain is part of getting older. And I've had patients even in their 20s and early 30s be told that their back pain is because they're getting older. In fact, it was a recent 31-year-old mom who was a runner and she liked to work out and play with her kids. And she was told that she had the spine of an 80-year-old. Okay. So automatically, when we think, okay, well, I got the spine of an 80-year-old, well, I better stop doing all the stuff I'm doing right now, or it's going to get worse. And then I'll have the spine of a 90-year-old and a 100-year-old. And unfortunately, or fortunately, this is actually not the way our spines age. And in her case, she was told to rest 6 weeks, take some anti-inflammatories, and maybe think about giving up running. But problem is, running for this person was her stress relief. It was her tribe. And it's if you think you're being told those things in your 20s and 30s, we'll just think about what you're being told in your 40s and 50s and 60s. But the interesting thing about back pain is that people reporting back pain actually peaks around the age 40 and actually goes down after that. So if we think about it, so like the signs that they see on an MRI, if we happen to be getting older and our spines keep showing that, uh, then and a lot of the things that you see on an MRI are found in people that are pain free. And the older we get, the more of those things we see. Well, how much is back pain really about getting older? And when it peaks at age 40 and actually goes down after that. So the people that in their 50s, 60s, and 70s going to their doctor for back pain actually goes down. So this is one of the myths that really just holds people back. And if you get anything from this video, I hope it's that back pain is rarely, if ever, about age, and and really there's a whole lot that can be done about it. And for myth number five, and this is one that's pretty persistent. You'll often hear like your massage therapist or your trainer talking about this, that if only you had a stronger core, you wouldn't have back pain. And so this trend actually got started about the mid 90s, really where they started focusing on core specific exercises for strengthening to both prevent back pain and to treat back pain. And our challenge is that what we found in people when they've studied the people's ab muscle strength and their back muscle strength is more often than not, for the stuff that life throws at us on a daily basis, our core is actually more than up to the task of protecting our spine. And a lot of times when people feel a weak core when it comes to back pain, that our feeling of weakness in our core is actually more a result of back pain and not the cause. Kind of makes sense, right? So if you think about it, if I'm dealing with back pain, all right, because usually most of us aren't going to test our core before we get injured. But if you think about it, if I'm dealing with back pain, then it makes sense that my alarm system would be like, okay, we're not going to let you go full throttle. And so it actually turns down the ability of what your core can do when the back pain is, when you're having a spasm, when you're having pain going down your leg. And so more often than not, that feeling of core weakness is often as a result of the back pain and not the cause. And more often than not, when you're able to sort out the back pain, even without strengthening your core whatsoever, you'll find that that core strength and that feeling of strength actually returns without you having ever done any strengthening exercises to it. Really, most every day in the clinic, more often than not, people have been told these things either by their doctor or they see it in their radiologist report. And very rarely are they ever told that a lot of the things that they find are actually found in people that are completely pain free. And so, if you're looking for a treatment approach that gives you the power to heal yourself without having to resort to drugs, shots, surgery, or just relying on somebody else to fix you, maybe you've been skeptical about that anybody can even help, or maybe you've even had a bad experience in the past. So I'm offering 3 absolutely free consultations, which is our total body diagnostic. So you can have the chance to have somebody finally listen to you, discuss your options for natural self healing. Now, these spots are limited and are on a first come, first served basis. So if you're confused where to start, you can book a call from the comfort of your home or office on the schedule for one of our back pain and sciatica specialists. Or maybe you need help now, you can come by and talk with one of our doctors of physiotherapy at no charge. These consultations will give you the opportunity to come in, meet us, see for yourself if we can help you. A couple of things that you'll learn in our free consultation is what's the underlying cause of your pain, roughly how long it'll take to fix the problem, and what to do to help, which doesn't include painkillers, resting, or surgery. So, what are your natural healing options? And then our consultations are great for anybody who might be unsure if physio is right for them. And they'll give you the opportunity to ask the questions and see for yourself if we can help you. Hi, and welcome to TallahasseePT.com, home of Biomechanics Physiotherapy and Fitness. I'm Dr. Brandon, the owner and lead physio here at Biomechanics. And I just wanted to start off by letting you know who it is that we help and then how to best use this site to get the information that you're looking for. So, for starters, we help active people in Tallahassee quickly recover from